Hi, hello, good morning to everyone. I'm Dr. Harika Kishore on behalf of Vista's Learning. I'm here as your biology educator. Vista's Learning, it's an online education platform which works with an ideology of providing quality education for all. Visit our website www.v-learning.in where you will get an access to all the live classes, recorded sessions, study materials, and you are also going to get this lecture notes in the form of PDFs. And get your acquaintance with all the channels available and make sure that you subscribe to the channel Vista's Learning Class 11 and 12. And also make sure to click the like as well as share this session with your friends. And also click on the bell icon such that you will get all the upcoming video notifications. Let's start our today's session where we are in the chapter Human Health and Diseases, which comes under the unit Biology in Human Welfare. And today's topic is the last topic which comes under this chapter, that is Adolescence and Drug Alcohol Abuse. So in the previous session we have a discussion about what are all the different types of the drugs which are available and what are their effects on our health. And in today's session, let's discuss about the adolescence, most vulnerable stage of human beings, and this is a duration which forms a bridge between childhood and an adulthood. Therefore, this stage is very vulnerable, and the persons who are under this age of ranging from 12 to 18 years, they are more excited with more of energetic behavior, and even there are a lot of changes that comes over there, both mentally, physically as well as psychological development. All this happens under this duration, under this period of life cycle. Let's have a discussion about adolescence first. Adolescence, it's a process, it's a period. We can say it's a period, it's a process during which a child becomes mature in terms of his or her attitude, beliefs, norms, all they will inculcate that beliefs or positivity, negativity or whatever. The beliefs or the norms that are going to develop during this stage, and it is going to show that effect in the remaining stages as well. And here we can say in terms of his or her attitude, beliefs for effective participation in the society. And also we can say that this is the period between 12 to 18 years of duration. 12 years to 18 years of age may be considered to be adolescence period. It may vary. In some books they refer to as the 11 to 19 years, and overall we can say 11 to 19 years of the duration, we can say the people or the individual are at their adolescence period of stage. Now, in other words, the adolescence is a bridge between two stages. One is childhood and other one is adulthood. So linking, it's a bridge which is linking the childhood and adulthood. Therefore, it is accompanied by several biological, behavioral changes, and as well as it is a stage where we can see a lot of vulnerability, very vulnerable phase of the life where mental and psychological development happens. Mental and psychological development of the individual mostly happens during this adolescence stage. That is what it is very, very important, very, very sensitive and also very, very vulnerable stage, because it is full of anxiety, excitement to know the new things, and also there are the characters like this duration is more accompanied with the adventure, excitement, knowing the new things, and lot more exposure will come to the individuals at this particular stage. Therefore, the care, extra responsibilities and extra care should be taken of this adolescent stage, when the students or the children are reaching to this adolescent stage, there is a big responsibility that were on the parents as well as on the teachers' side to take care of this adolescence age such that the youngsters will be directed towards a positive path in their life. Now, these are some of the characters we can see during adolescence, like curiosity. This is the very biggest character. Curiosity, need for adventure, excitement, experimentation, to know the new things, tendency to do experiments, to know the new things, constitute common causes to motivate these youngsters towards the usage of alcohol as well as drugs. All these features, all these characters are very, very good if they are directed towards a positive way. The same things, the other side, if they are directed towards a negative side, where this precious duration, if it is being wasted towards the usage of this or abuse, we have to say, abuse of alcohol or the drugs, then it is going to show a very, very adverse effect, and even it is going to be very lethal to their life also. A change, natural curiosity motivates them to do experiments, to taste new things. This is complicated further if they are having the combination habits like taking smoking or taking alcohols. See, it is complicated. It's going to be complicated further by effect that might be perceived as benefits of alcohol or drug use. The point of perception keeps on changing from one individual to the another individual. These adolescent age people may think that taking this drugs or smoking or taking the alcohol as a good thing, as it is making them to feel euphoria, that is intensive happiness. For a time being, it is giving intensive happiness, but on the long run, it is going to show very, very harmful effects. But at this stage, they are not aware of all these harmful effects, adverse effects that are going to come in a later stages. Therefore, proper awareness is very, very important, and it is going to help rescue them to get out of these adverse situations. Next, thus, the first use of alcohol or the drugs is just out of the curiosity. They just started it as a curiosity. Then it is going to start as a habit. Then at regular intervals, they are going to take this. Then it is slowly going to a very dangerous condition, and that is called as addiction. Where if they once reach the addiction stage, once they have decided to come out of that usage, then they are unable to get out of the usage because they are being trapped by the addiction, and it is going to show the withdrawal syndromes. Withdrawal syndromes are very, very complicated condition which doesn't allow the individual to quit that habit, to come out of that addiction. Experimentation, and later the child starts using to escape facing problems. They find it very simple things or also very complicated things, and they started to escape from that situation. They started to escape to face the consequences, reality, and they slowly start repetitive, regular usage of these drugs. And they feel the smallest things also to the stress level, and at late this stress, pressure to excel in educations, or what do we say, examination fear, all those very small regular things also make to be a very big thing to them. And in order to escape from this reality, the individual starts addicting themselves towards the regular usage of the drugs or the alcohols, has played a significant role in pursuing. They thought like usage of the alcohol make them relax, make them calm down from that stressful conditions or the pressurable conditions, and they start to addict towards the usage of the drugs or the alcohols. Now, the perception, their point of view, how they are going to treat that habit. They feel that taking a drugs or the alcohol make them to escape from the reality, and in that perception, in their own perception, they thought that taking drugs or consumption of the alcohol is fashion or cool, or it is a progressive. They thought it as a cool thing and progressive in their lifestyle. They feel that smoking or taking alcohol makes them to be chill or cool, and they find it as a fashion. Influence of the movies or the newspapers, even televisions, this is also going to show a very lot influence on the youngsters. They find the usage of these drugs, alcohol, in also in a way a major cause for the youth to start this habit is just to feel them as a cool thing or progressive thing. And as we said that televisions, movies, newspapers, internet, all these things also helps a lot to promote this perception. This is completely their own perception, which is completely wrong. Other factors, this is one of the factor, and moving to the other factor which influences, which motivates them to go to the usage of this drugs or smoking or taking alcohol, is other factors that have been seen to be associated with the drug as well as alcohol abuse among the adolescents, or unstable as well as unsupportive family structure. Proper and appropriate support has to be there always from the side of the family as well as from the side of the teachers. If that is not there, then the consequences are the individual starts addicting towards the alcohol or drug abuse. Because of this perceived benefits, short-term benefits, drugs are frequently used repeatedly. First, they have started out of the curiosity. Then it's slowly progressed as they find that this is the solution to escape from the reality and to come out of the stress, to escape from the stress, what they think, and even to escape from the reality, or maybe examination fear, or maybe they are not excelling in the academics. These are the several factors. And even they feel that the smoking or drinking is fashion, cool, and progressive. They are progressing in their life. All these things, they may be motivated by this medium outside. All these things may act as a fuel to motivate them towards the usage of this drugs. The most important thing which one fails to realize is the addiction. It is not fashion, it is not cool, it is not the one thing solution that can make them to escape from the reality. These are all myths. The reality is that they have to face the reality and they have to maintain the healthy lifestyle. And they can't realize that it is the inherited addictive nature of alcohol or drugs. Drugs themselves have this inherited addictive nature. They're definitely going to addict you. So this addiction is a very, very dangerous thing. And if the situation is going to the level of that drug addiction, they themselves can't come out, they themselves can't quit to this habit. Addiction is a psychological attachment to a certain effects such as euphoria, extreme, extensive excitement. This is compulsorily temporary feeling. It's a very short-term feeling, that excessive energy, intensive excitement, nothing but euphoria, and a temporary feeling of well-being associates with the drugs as well as alcohols. And this is definitely a psychological attachment. They can't realize that the euphoria, what they are achieving, that an intense energy or the excitement is going to show a very bad adverse effect in the future, which leads to damage to the brain, kidney damage, heart damage, which is going to lead to the coronary diseases, right? Now, this drives people to take them even when they are not needed. While we are discussing about the drugs are, if they are taken under the purpose, under the health care provided advice, under the prescription of the doctors, to a certain optimum level, all the drugs which has been prescribed by the doctor to the patients, that is okay, because they are acting as an anti-inflammatory agents, painkillers. But if the drugs are abused without need, it is not at all needed, but still the individuals are being addicted to reach that level of high energy, high excitement, then only it is going to termed as an abuse. Or even when their use become self-destructive, self-destroyed. When repetitive use of the drugs, the tolerance levels of receptors which are present in our body is going to be increased. We know that receptors are present, and these receptors tolerance is going to increase. Then all these receptors responds only at very high concentration, high dosages of drugs. At the initial stage, if the very little dosage also is going to give that euphoria, excitement to the individual. But a regular usage after usage, then the individual is going to adapt actually, where the receptors which are present in our body, that tolerance is going to be increased. Then the same dosage is not going to work out. Then the individual has to go for the higher dosage. Then this is the very dangerous situation. Consequently, the receptor responds only. The receptors responds only to the higher dosage of drugs or alcohol, leading to greater intake and addiction. Greater intake and addiction. However, it should be clearly borne in mind, we need to understand clearly that use of these drugs even for one time. People may think that if we are going to use repeatedly, then only it is going to show that addiction level or whatever the adverse condition that will come only if we are going to use it regularly. That is not the thing. Even if you use it for a single time, then also can be a forerunner to addiction, because it links to psychological relation. It is going to affect psychologically. Therefore, even a single usage is also going to show a lot of adverse effect. Thus, the addictive potential of drugs and alcohol pull the users to the dangerous, vicious circle leading to the regular use. That is when it is going to be abused, from which she or he may not be able to get out. They can't quit that habit. They are unable to quit the habit. In the absence of any guidance or counseling, the person gets addicted and become dependent on their usage. In order to, every time they feel lonely or they are not comfortable, they take it at the level of a much pressurized situation, and to escape from that situation, they keep on using regular usage of this drugs or the alcohol become a habit, and that is the stage we call it as an addiction. Dependence, and that is what we are calling it as a dependence. They are depending on the usage of the drugs or the alcohols. Is a tendency of the body to manifest a characteristic and an unpleasant withdrawal syndrome. If they themselves realize that the usage of this drugs are going to be abused, so I want to quit. They have decided, but they can't do that. because they have been already under the effect of the syndrome, and that is called as withdrawal syndrome. What is this withdrawal syndrome? If this withdrawal syndrome is seen in the individuals if they are discontinuing these drugs or the alcohol like disruptively, like a proper discontinuation is needed. Now, this is characterized by, all these are the characteristics of the withdrawal syndromes, which is characterized by anxiety, shakiness, nausea, sweating, which may be relieved, which may be revealed when use is resumed again. They reuse it, then they feel relief from all the syndromes. What are they? Withdrawal syndromes. Now, in some cases, this withdrawal syndrome can be severe and even life-threatening, and the person may need medical supervision. Dependence leads to the patient to ignore all the social norms, responsibility, how to behave. All these things will definitely have a great effect. In order to get sufficient funds to buy the drugs or the alcohols, they are going to fulfill their needs by robbing or stealing, where they are going to face disrespect from the society. This results in many social adjustment problems. This is going to create many social adjustment problems and even anger management problems. So look at here. This immediate adverse effects of drugs and alcohol abuse are manifested in the form of reckless behavior. They totally become irresponsible. Reckless behavior, vandalism, dangerous situation, violence, anger, and violence, as we said that. They become so rebel, aggressive nature, extensive anger, and excessive dosage of drugs may lead to coma or even death due to failure of respiratory functioning, that respiratory failure, heart failure, and cerebral hemorrhage. These are very, very dangerous situations. A combination of these drugs and their intake along with the alcohol generally results in the overdosing, and even it is going to cause death of an individual. The most warning signals of this drug as well as alcohol abusers goes like this, where they drop in their academic excellence, drop in academic performance, unexplained, they can't be regular to their schools or their classes or colleges, unexplained absence from school and colleges, lack of interest in their own habits or to maintain their proper hygienic condition, personal hygienic condition, their withdrawal for anything and everything, like they wants to be isolated, alone, and depression, anxiety, panicness, fatigue, aggressiveness, rebellious behavior, like anger management problems, and deteriorating relationships with the families, friends, or the immediate contacts in their circle, and loss of interest in their hobbies. Even it leads to change in the habit, like eating habits changes, and even sleeping habits changes. So change in sleeping as well as eating habits, and fluctuations changes. Fluctuations can be seen in their weight loss or weight gain, and even appetite, loss of appetite or gain of appetite. All these situations are the warning alarms, and there may even be some far-reaching implications of drug and alcohol abuse. If any abuser is unable to get money, they are going to steal to buy their necessary drugs or the alcohols. The adverse effects are not just restricted to this, and even it is not restricted to the person who is under the addiction. That adverse effects even going to spread to its circle, to his circle of his family members, of her family members, or his family members, that person's family members or friends or the close circle is also going to face this adverse effects. At times, the drug alcohol addict become the cause of the mental as well as financial distress to his or her family members as well as friends. Those who take drugs intravenously, directly to the veins, direct injections into the veins using a needle or the syringe, as we already know, these contaminated needles and the syringe are the major cause for the transfer of the viruses which causes AIDS as well as hepatitis B. So therefore, much more likely to get severe infections like AIDS as well as hepatitis B viruses. Both are caused by viruses, and this virus can be infected by the contaminated syringes as well as needles. The viruses which are responsible for causing these diseases are transferred from one person to the other by sharing the infected syringes as well as needles. Both AIDS as well as hepatitis B infected are chronic infections, and definitely it is going to cause the fatal, that is death. The use of alcohols during adolescence may also have a long-term effect, because the adolescent stage is very initial stages. Then it is going to show its addiction stage at his or her adulthood. It could lead to the heavy drinking in their adulthood stage. The chronic use of drugs and alcohol damages nervous system and also damages to the liver, which is called as a cirrhosis. The use of the drugs and alcohols during pregnancy, it is going to show its adverse effect on the developing fetus. The developing fetus also shows so many conditions which are a result of his or her mother addiction to the drugs or alcohols. Another misuse of these drugs can be seen in the case of sports persons. So in the sports person, they are intended to increase their performance such that they'll depend upon the use of some of the drugs. Here, misuse, it's not a proper use, it's an abuse, misuse of narcotic analgesics, anabolic steroids, diuretics, and certain hormones in sports persons. They use to increase muscle strength and bulk, as well as to promote the aggressiveness, extensive aggressiveness. As a result, they can increase their performance in the athletics. That is why some of the sportsmen release on this use of drugs. But it is going to show a lot of side effects both on the females as well as in the males. So the side effects of the usage of this anabolic steroids in females, which includes masculinization, that is developing the male features like increased aggressiveness, mood swings, depression, abnormal menstrual cycle, excessive hair growth on the body as well as face, and enlargement in clitoris, deepening of voice, which is relatively a male voice. And the side effects which can be seen in the males, which includes aches, increased aggressiveness, same, mood swings, depression, reduction in the size of testicles, sperm count is very less, and even they will show decreased chances of being dysfunction of the kidney as well as liver, enlargement in the breast size, premature baldness, and prostate gland enlargement, loss of hair, which leads to premature baldness. These effects may be permanent with prolonged usage of the drugs and the alcohols. In the adolescents, male as well as female, severe facial body aches and premature closure of the growth centers that are present on the long bone is stunted, such that if the growth is being stunted, that means stopped, it is going to result in the stunted growth of an individual. The age-old proverb, adage, that is prevention is always better than the cure, holds very, very true in the case of alcohol as well as drug abuse. It is also true that habits such as smoking, taking drugs or alcohol are more likely to be taken up at the young age and more during adolescence. Hence, it is best to identify the situation that may push an adolescent towards use of drugs as well as alcohol and takes appropriate remedial measures well in the time. In this regard, the parents and the teachers has to take special responsibility. Parenting that combines with high levels of discipline, nurturance, that is nourishment, not only physically but also emotionally. The care should be taken emotionally such that support, proper support has to be there from the family side as well as from the teacher side, such that to give a confidence that an individual can leave the or quit the addiction. Associates with the lowered risk of substance, that may be alcohol or drug or tobacco abuse. Every child has his or her own choices, and that has to be taken into consideration by both the parents as well as by the teachers. That is what we can avoid the undue peer pressure. Beyond their capacity, no parents or no teacher should push the students to perform very well in their academics. That space has to be given such that the child is not under totally extreme pressure, such that he'll take an option of taking the alcohols or the drugs, such that he is going to be addicted. Here, every child has their own choices and they have their own personality, which could be respected and nurtured. We have to give a space, respect their feelings, respect their choices. Then the child shouldn't be pushed unduly to perform beyond her or his threshold limit to be best in their studies or sports or other activities. This pushing, pressurizing children to be best, to perform best in their studies or the activities or the sports beyond their capacity, their ends, they are going to pressurize much. They are going to face stress much. Every child has, that is what we just now discussed, educating and counseling to face these problems or the stress and to accept disappointment. It is okay to be disappointed. It is okay to get failed, because these are all the experiences, good and bad experiences, both comes in life, and we have to take and we have to learn from out of them. Disappointments and failures as a part of the life. This is all as a part of the life. And it would also be worthwhile to channelize the child's energy into positive pursuits of sports, not only studies, sports, reading, music, yoga and other extracurricular activities, such that they shouldn't be pressurized beyond their threshold limit to perform the best in only studies. Studies is not only the thing, it has to be combined with the other extracurricular activities too. Help from parents and peers should be sought immediately so that they can guide appropriately. Help may even be sought from the close as well as trusted friends. Besides getting proper advice to sort out their problems, this would help young to vent the feelings of anxiety and guilt. All the parents and teachers need to look for and to identify the danger signs, warning signs, whatever the list we have already discussed, that they has to be preferred to be alone, that is isolation, And even anxiety, loss of sleeping, change in the sleeping habits, eating habits. These are all the warning signs that has to be taken care of. Even friends, if they find someone using drugs or the alcohols, they shouldn't hesitate to bring to the notice of their parents or the teachers such that they can be concerned proper and they can be helped properly. Support can be given to that individual to get out of that habits. A lot of help is available in the form of highly qualified psychiatrists as well as psychologists, and also there are availability of de-addiction centers, rehabilitation centers are available to help the individual who have unfortunately got into the trap of this abuse of alcohols or drugs. Now, with such help, the affected individual with sufficient efforts and willpower, this is the very important thing that plays a very crucial role to quit this addiction, can get rid of the problems completely and lead a perfectly normal and healthy life. So these are some of the measures that can be taken to help the individual to come out of these addictions. So this is the last topic that comes under your chapter, human health and disease. We come to the end of this chapter. In the next session, we are going to start up with the next chapter. Until then, keep learning with We Learning.